Welcome back, where we have Dr. Tanya Dahl and Dr. Justin Yannick here on behalf of Renew Ketamine Infusion. Well, welcome both of you to the show. Nice to meet you.
Thank you
Thanks for having us.
So before we get into what ketamine infusion is and pretty much what your facility is all about, tell me a little bit about yourselves.
So yeah, my name is Dr. Justin Yannick. I trained in emergency medicine actually with Dr. Dahl in residency at UC Irvine, and then I did a pain fellowship at Harvard Mass General Hospital. And then ultimately now I practice both emergency medicine, pain medicine, and then we've started this clinic, Renew Ketamine Infusion.
All right, fantastic. And how about you?
I'm Dr. Tanya Dahl. Thanks for having us. I trained at UC Irvine in emergency medicine, board certified. Also practicing at Mission Hospital in the emergency department, so serving the community in many ways.
Okay, so you're at Mission now, serving at ER.
Correct.
Okay, great.
Yep.
So let's talk a little about really why ketamine works, what it is, and how you guys monitor your patients. So, for instance, ketamine I've seen can be used for a lot of different things, and it's been around for a really long time.
Yeah.
Tell me a little bit about what it is made from.
Sure. So it's a synthetic molecule. It was developed in the 60s, FDA approved in 1970, and it was originally approved as an anesthetic. And it's a very safe anesthetic in the sense that it preserves people's ability to breathe and have a blood pressure. So this was widely used in the battlefield, actually, in the Vietnam War, as a way to basically safely transfer victims of war from the battlefield back to a medic tent and have them not suffer from their injuries in the meantime.
Okay.
Dr. Dahl and myself use this routinely in the emergency department to do procedural sedation, to sedate, like, let's say a 2-year-old that has a laceration that we have to sew up. You give them some ketamine, it dissociates them, and then you can ultimately do the suture repair. So it's been used in multiple indications. For mental health purposes and chronic pain, last 20 years it's been studied, and there's an enormous amount of literature to prove its efficacy in treating those conditions.
Okay. Now you mentioned that you are still working in the ER, so you're seeing the usage of that today.
Correct.
But one other thing that you may have seen over the last several years is that there's some people who may suffer from depression and isolation because of COVID. So for instance, one thing that I was wondering is that if you have a patient who is going to die, and then the loved one can't be with that patient, what are you seeing there, and how ketamine could possibly help someone like that?
Yeah, so the COVID-19 pandemic was hard, obviously, on everybody in different ways. And being an emergency provider, I not only had to witness the terrible deaths of people that are dying from COVID-19, people that are dying alone, but also having to help treat patients that were coming in with really severe depression. People were being isolated, people were lonely, people were scared, people were turning to substances like drugs and alcohol. And so these are people that were on lots of medications, maybe had tried multiple antidepressants in the past, and nothing was working for them. And so there really were two pandemics. There was the COVID-19 pandemic and the mental health crisis that went along with it. And so here at Renew Ketamine Infusion, one of the reasons why I decided to build this business with Dr. Yannick is I wanted to not only be able to help people in the acute setting, but also be able to help the other people that were suffering in silence and were just not finding relief.
Okay. So you've told us what it is from. Now, what does it actually do to help people with depression, isolation, and a variety of other things that you can treat with it?
Yeah, so its mechanism of action is, to simplify it basically, is when you have chronic suffering, whether that's from pain or whether that's from depression, we know anatomically that you have a reduction in the amount of synapses in your brain. Ketamine, through its action in the brain, can actually lead to something called neuroplasticity, which is an increase in the amount of synapses and the effectiveness that these synapses communicate with each other. And so that's a part of how ketamine works to treat these conditions, basically to allow your brain to process stimuli in a different way, in a kind of to somewhat oversimplify it. An equally important part of it, though, is the psychotherapy side of things. And so ketamine opens you up to what the therapist will have to tell you in terms of ways to act moving forward based off of previous events that you've had.
Okay.
And it can be a very effective modality to combine the two things.
Does that work like a hypnosis? Because I guess if you were falling under a hypnosis, then they would tell you something and then you somehow, not consciously knowing. Does it work something like that or no?
It's an interesting question, and there's been some studies that have gone into people, like say, for example, that have PTSD.
Right.
If they actively go into the ketamine infusion, trying to work through whatever that prior trauma was,
Right.
is it more effective in the long term? And there is some evidence to prove that it is. And really how it works is, with trauma therapy, you're not designed to forget the traumatic event. It's about acknowledging that it happened, but not letting it control your life. And ketamine is able to separate those two things, basically.
Okay. So do you have an on-site therapist, a psychotherapist?
So we work with a therapist who went through a year-long training on ketamine-assisted psychotherapy.
Okay.
So she's specialty trained. She works virtually with patients.
All right.
So what you can expect is you come into the clinic, it's just you and us and our RN, our team, and the treatment's really all about you and making this everything that you need it to be, bringing you into a comfortable, tranquil, spa-like environment. And so you're going to come in and we're going to talk to you briefly, and then we'll set you up with the in the recliner, just as comfortable as possible, with an eye shade and noise canceling earphones, playing kind of spa-like music. And so yeah, that's kind of what you can expect for the treatment when you come into the clinic. And then you will meet with the psychotherapist virtually the next day.
Okay, so so you obviously need records from the individual that's coming in. So if they wanted the doctor to transfer the records over, would that be something they should do, or do you have them just answer questions that's your own?
Yeah, it's a combination of both. So first we have an initial free consultation, so it's no charge to the patient. We speak to them for 30 minutes to 45 minutes, getting a medical history from them, making sure they're safe for ketamine, that it would be indicated for them. And then if we feel like we would need outside records, our electronic health record system would allow us to basically request records ourselves. So it makes it very easy for the patient, so they don't have to go about trying to collect all this stuff for us. We can just get it directly from their office.
Perfect. That just makes it a lot easier for everybody, for sure. So let's talk about who is a good candidate and who isn't a good candidate.
Yeah, so good. Basically, ketamine, we're not using this as a first-line treatment. It's for people that have tried and failed other modalities. Typically, let's say for depression, you've tried and failed 2 or 3 antidepressants, you've done talk therapy, and you're not getting substantial relief, or you're having intolerable side effects. Ketamine would then be indicated for you. People that it would not be indicated for are patients that have a history of epilepsy, so seizure disorder, or patients that have a history of schizophrenia or mania. There's other small relative contraindications, but that's part of that initial consultation, is us going over that expansive list. But those are really the 2 major ones, seizure disorder and history of schizophrenia.
So there was something on the list that I actually wanted to ask you about. It's addictions. So what kind of addictions are we talking about? Drugs and alcohol?
Yeah, sure. So yeah, I mean,
You're the expert.
No, we both do this equally. But yeah, so it's like definitely a passion of mine. And so ketamine, it's one of those interesting things where it seems like a drug that you could be addicted to, but it can also treat addiction. And we see this with kind of other emerging psychedelics, psilocybin, MDMA, how these things that could be addictive are actually being used to treat addiction. The mechanisms of how that work are somewhat complicated, but ultimately we have real-world clinical evidence to show that this works. And so we're using it to treat things like alcohol, tobacco cessation, opioid addiction is a primary indication for it, because those are things that are difficult to come off of, and a fixed amount of ketamine infusions has been proven to actually improve people's ability to get off those.
So many of the folks in our that are viewing this, maybe they are suffering from addiction, and maybe they've tried the 12-step program and they've tried other things that really didn't work for them. So would that be a good candidate to come visit with you?
For sure, for sure. The excellent thing about ketamine is we use it for patients that have been refractory to kind of the standard treatments that they've been trying. And so let's say they have done the program and they have tried other things. Those are the patients that we really do believe that we can help. We want patients to be able to have a support system outside, and so people that do the 12 steps and go to the meetings, that just adds to the efficacy. So for sure, definitely.
Okay. Let's talk again about your facility and where it is located and how they get in touch with you. Now, one thing that I'm wondering is many people always want to know about insurance and how that comes into play. Is it covered in some capacity?
So the ketamine treatment itself is not yet covered by most insurances. Some are starting to cover it, and I think others will get there with time.
Sure.
Because the data does show that it really does help people. What we're doing is we are having patients pay up front, and then we use our electronic medical record to generate a super bill that we will submit to the patient's insurance on their behalf, and they can expect to hopefully get a reimbursement. And it's not billing for the ketamine infusion, it's billing for the services like the physician consult and the office visit and the IV placement. So we're definitely able to get some reimbursement for patients using our EMR and submitting the super bills.
Okay, great. So when somebody comes to visit you, how long is the consultation?
So the consultation is virtual, the initial one, so they can do it from wherever they are. 30 to 45 minutes is about right.
Okay.
Then they will typically speak with our psychotherapist, who will help them prepare for their first infusion.
All right.
Then they'll come to our office, which is in San Juan Capistrano. And in that office, they can expect to be there for about 90 minutes to 2 hours.
Okay.
40 minutes of that is the infusion, and then there's some processing time both before and afterwards.
Okay.
And then they're driven home, typically by a friend, family member, loved ones, things like that.
Now this is an infusion, so it's through a needle.
Correct.
Okay. And then afterwards, what should someone bring someone with them? Are they going to have a feeling that maybe they can't drive?
Yeah. So we recommend that if patients are able to come with a support person, somebody who's there to kind of help them get through the rest of the day, get them home safely, and just be there for them. They can expect for a couple hours after the infusion to maybe feel a little uneasy on their feet, maybe a little loopy, and you want to make sure you have someone there to help support you through that.
Right. Well, this is really great information. I appreciate it. Very new to us here, and I'm happy that you were able to help us because, you know, many people have thrown in the towel with Western medicine and they don't know where to turn to, so we appreciate the information.
Yeah, thank you for having us.
Thanks for having us.
Thank you.
Yeah.
And if you want more information about the ketamine infusion from Renew, you can go to their website, which is renewketamineinfusion.com. We'll be right back.